everyone. So this video is to help you to understand how the digestive system works, the gut. And why is that so important? There's a lot of upcoming research that's connecting how the gut is impacting how you feel musculoskeletal. That's the muscle joint, and more importantly, the fascial system. The fascial system is just a system, a network that connects how the muscle joint works in harmony. So arthritis is where the fascia is not supporting and working, allowing the muscle joint to work together. So if we backtrack a bit, the digestive system plays a huge role in the health and the use of fascia, muscle, and joint. So let's go over to here. So the name of the game is, if you put food in your body, yes, it's supposed to taste good, but it's supposed to give you fuel for your goals, your desires, what you want to do for the day, and your plan as whatever you want to be, a athlete, a parent, a grandparent. So that happens at your small intestine. Your small intestine has a thin membrane where it has a direct connection to your bloodstream. And so the food that you eat, and when it gets digested, it gets processed, and nutrients goes through the bloodstream, that membrane, the bloodstream, it goes throughout the whole body. So there's a lot of research in real connection between the mind and the gut. So if you have any ADHD, depression, brain fog, migraines, anything of the cranium, anything of the use of the brain, there's a equal connection to your gut. And so this is one link between that. The gut peptide, gut hormones going through that to your brain. So we want food to be digested, and this is solely for the purpose of nutrient absorption. So now, first part of getting food to digest happens here, the moment when you think about food. So when you think about food, your body produces saliva. Saliva helps to break, has enzymes to break down. There's a gland right here, help produce saliva to break down food. You chew your food and give the best chance for your stomach, to duodenum, your esophagus, and to not have to work that hard in this modern society, especially if you're stressed out, especially if you have a lot going on your plate, especially if you're ill, especially if you have multiple joint issue. You want to give your gut somewhat a break and only have to do what is necessary, nothing more. So if you have dry mouth, that can cause a big problem from the beginning, and saliva helps to break down carbohydrates, right? So chewing your food helps with the breakdown of your food. So then it goes to this sphincter called the gastroesophageal sphincter, which is one of the problems with acid reflux. So your GERD. Now your stomach has stomach acid right here, and it's very strong, like battery acid. It's supposed to break down the food and push it along the way towards your duodenum. Now, side note, this is where people who have acid reflux, in functional medicine, we believe that the root cause is low stomach acid. Hypochlorhydria is the fancy word. And so we want to actually increase stomach acid. Now, pending if you don't have an ulcer under supervision, there's a protocol to help you increase that. And so the logic is that when you don't digest your food because of low stomach acid, now food gets kind of settled and it ferments, and that pressure builds up and pushes this up slightly up where acid starts to spill up. You have little to very close to no stomach acid and still have acid reflux for this reason. And so we want to have a lot of stomach acid that fits your body's need. And so now, as you can see, here's the liver and the pancreas and gallbladder right here. Now those three organs connect to your duodenum. Your liver and gallbladder helps produce bile, store bile, and liver has 2,000 functions. So that helps to break down the food and your pancreas produce digestive enzymes. Both of those two help. They're like detergent. They help to break down the soil, linen, clothes, and so your liver and pancreas have enzymes to break down fat, protein, carbohydrates, all in preparation to go to the small intestine. Now, just a quick side note, this is where chicken or the egg. It could be overwork, overburden, not enough enzymes to break down the food, so your stomach has to work harder. Or your stomach with the low stomach acid isn't breaking down food. And now these enzymes and bile your liver and your pancreas has to overwork to break down the food. So chicken or the egg, we like to kind of work on both with visceral manipulation. If there's a mechanical, and then complement that with nutritional teaching, so then you can have a happy, healthy kind of upper GI. Now, towards the small intestine. On the side note, we have another video that talks about the 7 gut pathology that is important for you to know in terms of the functional medicine world, that even your GI conventional medicine might not know. So here there's gut dysbiosis. So your small intestine has an ecosystem called microbiome, and your microbiome has a healthy mixture of bacteria, viruses, yeast, and so they're good. And so when you're stressed out, you're sick, or your body's not up for it, then that can be peer pressure to become bad. And so gut dysbiosis is an imbalance where the body becomes peer pressured because it doesn't have the mental energy and physical energy, and becomes bad, so you have imbalance. So that's why probiotics might help, but that's a side note. I'm not saying to take probiotics. And so another thing is intestinal permeability. Basically that is, remember I talked about that thin film? Just a quick, that thin film opens up, and proteins and foreign pathogens can pass through, and now your body, it goes into your bloodstream, your body is on hyper alert and try to protect that, and you might have autoimmune condition because of that. And that can go all the way, transport to your hormones, your reproductive organs, your liver, or cross through your blood-brain barrier. Now, you can have something called SIBO, because as your food goes here, it goes here to the cecal valve here, cecum, to your large intestine. And large intestine is supposed to help absorb and take out water. It's that spin cycle of your when you do laundry, to pull out all the water, so then it could be a nice appropriate stool to come out. And so you can have constipation or diarrhea if it's it's not doing enough or too much. So now bacteria in your large intestine sometimes can creep up into your small intestine, and then you get SIBO, small intestine bacterial overgrowth. So that's how your digestive system works. And as you can see, there's a relationship as your digestive system isn't working as well, and it has a more of a direct connection to your bloodstream, which impacts the fascia and how you feel, and so on, so on, so on. And so another thing is when an organ in a visceral manipulation, not functional medicine, in visceral manipulation, we talk about the fascial system that suspends and infiltrates to the organ. When the organ is in a state of dysfunction, then it becomes bloodthirsty, and so blood circulation goes to here, 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 and here. Say you have your hips, okay, and so circulation, the priority is circulation goes towards a common spot, ileocecal valve. And so your hip and your joint doesn't get that adequate oxygen and circulation, and has that fascial tension, which compresses the joint, and it doesn't allow that unity, the harmony of the muscle joint to work well together, with a kind of dehydrated, these are loose terms just to kind of explain, okay, but it doesn't have an adequate circulation for proper function, for proper nerve muscle connection, and then so the muscle can't support the joint, and you get this lack of harmony between how you move and how you feel, And then you could manipulate this, treat it all you want, exercise, stretch out, a muscle that needs more suppleness. So then that's also not the best route. So you can stretch it out all you want, and your body will always win to protect this. So this is why your digestive system is very important, and watch the next video so you can understand the 7 gut pathology that functional medicine can help you with. And quick side note, you can have no gut symptoms and still have gut pathology. That makes the job harder. So we first focus on investigating, and then start treating you as a person, and not as a diagnosis, and not by a label. All right, please share this video, and so please share this video. Hopefully you find this helpful, because this is the talk I've been giving to a lot of my clients, and I decided to make a video because I've done it many times.